The Senate has failed to pass competing bills today that would address rising health care costs in the U.S. Democrats were hoping to extend the enhanced tax credits under the Affordable Care Act, also known as Obamacare, for 3 years. The credits, which were a sticking point during the government shutdown, are set to expire on December 31st. 4 Republican senators voted with Democrats. Meanwhile, the Republicans' proposal would have sent funds directly to consumers instead of extending the current subsidies. GOP Senator Rand Paul of Kentucky joined Democrats to vote against the measure. CBS News congressional correspondent Caitlin Huey-Burns joins us now on Capitol Hill. So, Caitlin, lawmakers knew these bills weren't going to pass, right? Why do they hold the vote then?
That's right, Lindsay. This was an entirely predictable outcome. Going into this, we knew that both bills were going to fail, and the lawmakers who proposed them did too. But both parties felt like they needed to come to the floor with something. As you mentioned, the Democrats have been talking about extending these Obamacare subsidies for a while now. It was the center of the government shutdown, and they were promised a vote to reopen, if they were to reopen the government, promised a vote on these health care extensions if they were to reopen the government. Well, today was that day. What they proposed was a 3-year extension. That had been a non-starter among Republicans who don't think that Obamacare is working in the first place, and they don't want to spend more money on it. But there is some support within the Republican Party for a little more temporary extensions of those subsidies, and that is part of other plans that have been proposed, and we'll see if those come up next week when the Senate returns. Republicans, though, know that they needed to have something to come to the floor with because the health care issue is such a big issue politically, and also they know these premiums are rising. So the Republican plan was to take that money and put it into health savings accounts. That, of course, did not pass, as you saw. So there is a question of what happens next. There's no question that this will be used as a political football through the midterms if not addressed. But in the meantime, there are many Americans who are caught in the crosshairs here. We talked to a couple of them yesterday who are going to see vast spikes in their premiums, and they just want Congress to address it in some way.
What kind of spike are we talking about?
Well, it depends, but some estimates, one woman we talked to said that she was going to see nearly 100% spike, others a smaller amount, but still a lot of people had told us that as they're considering all other aspects of the economy, high grocery prices and the like, that healthcare is something that they can't really skimp on, and that is a concern of whether you start to, how you start to budget for the next year, what you start to cut back on. Lawmakers on both sides, though, Lindsay, acknowledge that there are problems in the healthcare system that need to be addressed. They just have very different ways of going about it, and it doesn't look likely, at least at this point, that some consensus will be able to be made by the end of the year.
Okay, Caitlin Huey-Burns, thank you.